Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
Right? So if a person tells me, well, we're already working with another agency, instead of me just saying, here's my pens, here's my mugs, I'm going to say, hey, listen, I totally agree. The moment I walked in that door, I already knew that you were working with another agency. Now, other than the fact that you're working with another agency, what are 3 things that made you choose to work with those agencies in the past? As you guys can see here, remember I'm talking about the pain and pleasure? I circled back and I got them to start there, right? Because what happens is you walk in, you get past the gatekeeper, they call the social worker, they come up and be like, and you find out that you're actually doing home health or home care, and they're going to say, we're already working with another agency right now. But your job is to get information, right? Your job right now is to get the information so you know how to present and follow up with them. And that is such a vital thing you should have. So when they say, we're already working with another agency at this moment, sir, I already knew the fact that you were working with another agency before I even walked in that door. Other than the fact that you're working with another agency, and I know they provide great care, what are 3 things that made you choose to work with those agencies in the past? Bam, right there again. What if you hear them say, we don't have any patients right now? Hey, perfect, I totally agree. More likely, you are already working with another agency at this moment, and that the fact that since you don't have any patients right now, you've given it to them. Other than the fact that you don't have any patients at this very moment, I was wondering, what are the 3 things that made you choose to work with agencies in the past? Just bring it back right there again, right? Why just Medicare? Hey, listen, perfectly agree. Medicare is an important thing, and the majority of the patients are taking Medicare. And I totally agree that, other insurances are important for you as well. If you don't mind me asking, what are 3 things that made you choose to work with other agencies in the past, other than the fact that they only accept Medicare? See, what you're doing right there is you're always going back. The goal here is just think about a straight line, right? It's point A to point B, all right? From point A to point B, before you can even reach point B, you're going to receive objections. Stop, objections. Your job is to go past those objections and keep on going, right? Home health is a fraud. Hey, listen, I totally agree. Home health is being seen by a lot of people as a fraud. And the reason for that is a lot of people are not doing it the right way. And my goal is to be able to work with a company like yours who wants to provide great care for your patients and to make sure that we do it the right way. Other than the fact that you feel that home health is a fraud, what are 3 things that you have made a decision with to work with other agencies in the past? Right? I'm going to keep on going. Right? I'm busy today. Hey, listen, totally agree that you're busy today. I appreciate the fact that you walked out of your office. Other than the fact that you're busy, I just need maybe 2 to 3 minutes of your time. Is there a possibility I can ask you a few questions before you head back? Sure. Great. What are the 3 things that made you choose to work with other agencies in the past? I'm always going to go back to that. Always going to go back to that. Because once again, it's in the qualifying phase of things. We haven't earned their trust enough for us to even present to them yet. And so that's what we're trying to do. The main goal is to get past the gatekeeper, get past qualification, and do a presentation. We can either do that the same day, or we hit too much objections that we need to find out later on how we can reschedule. Okay? And so that's why this is such an important thing, is that if you can set up an appointment earlier on, you have a higher stage of jumping in to be able to present yourself easy and to have a higher conversion rate. That's why cold calling is such an important thing. But if you can't cold call everybody, if nobody else is going to be accepting you out there as much, well then at least you get some information as much as possible, right? It's all about keeping on moving forward. Point A to point B, the way it works pretty much for point A to point B is from getting into a facility and then making sure that you get a what? A referral. At every step of the way, you're going to face some objections and you need to be able to handle that. So there are 4 types of objections really. There's what we call the stall, or time objections. I'm busy right now. I'm in a meeting right now. Come back next week, right? Then there's what they call the SVC, or what we call the product, right? The product or the service, right? This is, hey, some agencies out there, like for example, home care. Let's do home care right now. Some of them offers medication reminders, like we do, for example. Others don't, right? Do you have a medication program, or do you have, for example, a diabetes program?
Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.